I'm Dr. Dan Michaels with the Reconstructive Foot and Ankle Institute, and I want to talk about PVD today. PVD is peripheral vascular disease. Your arteries in your legs and your feet don't work very well sometimes. We see a lot of these problems today now because so many people have diabetes, and diabetes causes fat to accumulate in your arteries. And really, blood is supposed to be going through your arteries. Consider like arteries like garden hoses in your legs, and they bring blood from your heart down to your feet to nourish the structures in your foot and ankle. And if those garden hoses get clogged up, then blood can't get down there. When you come in for an appointment, we check your pulses on your foot and your ankle, and there's a pulse in the top of your foot and behind your ankle. And so we feel those, and if they feel fine, then usually that's an indication that you have good blood flow. But if we can't feel these, then we want to do a test to determine how good or bad your blood flow is. So the test that we do is non-invasive, doesn't hurt, takes about 20 minutes in the office, and it's just a matter of taking a blood pressure essentially at various levels on your thigh and your leg, and by that a computer can sense how much blood flow you have coming down to your foot and ankle area. This kind of condition is similar to a heart attack. You know, if you have a heart attack, one of your coronary arteries gets clogged with fat, and then the blood can't get to your heart, and you have a heart attack. Well, the same thing happens to your feet or anywhere else in your body. You know, that's why people with diabetes have problems with their eyes and their kidneys and their feet, because these arteries that go to these organs are very thin, and they get damaged quite easily with just a little bit of fat or a little bit of inflammation. And so we have, you know, the diabetic nephropathy and neuropathy and retinopathy. So there's a lot of different problems that can occur with this inflammation and with this fat accumulation inside the arteries. But by coming to us and using us as kind of like a first-line defense against this, we can detect it, and then we can order a simple, painless, non-invasive test that can determine how good or how bad your arteries are. And sometimes, you know, when people don't have these pulses, their blood flow is actually fine. Other times, they don't have pulses, the blood flow is a problem. And then more things need to be done to figure out where is the blockage in the artery. So there are additional tests after that that we can do. But initially, it's not a screening, it's actually a good test to determine the level of perfusion or blood flow you have going to your feet. So we focus on these things because a lot of times we have people with wounds and foot and ankle problems and injuries, and without blood flow these things can't heal. So understanding that blood flow affects the foot and ankle tremendously is really important. So coming in and letting us treat you comprehensively to fix these problems is very important. And if you don't have pulses in your foot, chances are we will need to do a non-invasive vascular test to determine how bad or how good your blood flow is. It's simple, it's painless, it takes about 20 minutes, and it's good for your health.